So he grew up here. He attended Kenyon College, and he received his master's in social work from VCU, I think in 2000. He has been with Circle Center since 2013. He's married. He lives in the museum district with his wife Courtney, and they have 2 children, 6-year-old Allie and 4-year-old Corbin. So please welcome Jay.
Thank you so much for having me here today. Can you hear me all right? Yeah. I told Eleanor I work with older adults, so the best way to engage with you, older adults, I find, is to walk around and move and really connect with you in person and not to stand behind a podium. And then also I can project my voice very loudly, so if I make you deaf this morning, just let me know. So I come to you today with, well, first of all, whatever you all were praying about in the 9 o'clock service, keep doing it. Because as we drove here, it started raining. And I thought, what a sign on a Sunday morning that I'm doing the right thing, or that it's all going to be okay. So that was a beautiful sight, and I'm happy to be here with you in this lovely church, a lovely space on a Sunday morning. And I come to you as a social worker who, I like to say, knows a little about a lot. Right? And your theme of connections, something I've been ruminating on a bit lately. Really, what do social workers do but connect you with things, resources. So in one sense, my job is very rewarding in that I get to, again, connect you to tangible resources. And then the other thing is that we get to sort of work on your mind and change the way you think. So it's an interesting profession in that regard, very fulfilling. We can really treat this like a conversation today about aging, what services are out there for us as we age. I've had the privilege of working in a variety of settings for older adults, and that's really what I'm going to talk to you about today. Within each of those settings, we care for people with memory impairments, neurocognitive disorders, dementia, Alzheimer's being the leading cause of dementia. And Eleanor told me that that was something that this group wanted to talk about today. So if you have general questions about caring for someone with Alzheimer's disease or one of the related dementias or care settings, I think this conversation informs that just based on my experiences of where I've worked and what I've done. Let me back up a little bit and tell you a little bit about myself. Eleanor did most of the preliminary work there, but why do I work with older adults? First of all, I find older adults very interesting. Anybody older than me has had experiences that I haven't had, and I want to know about that. Secondly, as a graduate student, the age wave is upon us, and simply for selfish reasons, being able to work with older adults keeps me working, right? Secondly, or thirdly, I should say, interesting thing about aging, you can do everything right. You can eat your vegetables. Now, somebody mentioned prevention, what we do to prevent these things that happen to us, Alzheimer's disease, cancer, what have you. You can do all the right things as a human being. You can go to church every Sunday, eat your vegetables, exercise, all those things that we're supposed to do. And you can still end up with Alzheimer's disease, cancer, whatever it may be. And you're at the mercy of someone else's care. And how good are they at that care? How competent are they? So that's really what drives me in my work for the last 20 years is supporting older adults and allowing them to live how they want to live. And as we rethink notions of retirement, what that means, again, the competency and the empathy of the professionals that work with older adults is at the forefront. We're facing a shortage now of in-home caregivers. So places like Circle Center, adult day healthcare centers, can become an integral part of what we do in caring for older adults. But back up a little bit, other reasons why I like working with older adults is it's fascinating to see how we approach aging. Everybody does it differently or has a notion of what the latter third of our lives is going to be like. We're somewhat age-averse here in America. And they're not just Americans, but across the world, there's issues with being. How many times have you heard the phrase anti-aging? What does that mean exactly? Sort of sounds like anti-living. The purpose of life is to experience things and grow older, and to relish the fact that there are really good things that happen to us as we age. But we don't want to think about it. We think we'll be independent forever. Our country is founded on that strong independence streak. We can do it ourselves. We don't need help. But inevitably, as we age, that works against us. So you remember I talked to you about social workers. We like to try to shift the way you think sometimes. And this is what I'm trying to do, to get you to think about aging and dementia care in a different light. Go back to Alzheimer's disease or dementia. There's a lot of stigma associated with these illnesses. We don't want to talk about it. Someone once equated it back in the 60s when somebody had cancer. They said, cancer, they whisper about it. It's a disease like any other. Presents its own challenges, of course. But again, we need to destigmatize it and talk openly about it. And I think that will serve us well as we encounter whatever it is that ails us as we get older. The inevitability of needing the types of services that an in-home care agency or rehab center, independent living facility can offer you. It's a fact of life, but we don't often want to think about it. We want to retire in our homes and think we could be independent there forever, but we often can't. We just must think about that fact. It's a tough fact, but it's reality, and I think if we confront it and talk openly about it, it opens up the possibilities. And what I encourage our caregivers to do is to really think about the what-ifs. What happens when I have a little trouble getting up those front steps? What happens when I can't get upstairs to the restroom, to my shower? Make plans for those things that allow us to age in place. And that's really where we want people to be. Where are you most happy? In your home. And really, we don't have the infrastructure to care for people in residential settings, and we're struggling again to find the right in-home caregivers. So you can see, in conjunction with the numbers of people that are coming to us, the baby boomers and beyond, the age wave we talk about, we've got some thinking and planning to do. And a lot of that thinking and planning can start with the people in this room in terms of your perceptions of how we age, what diseases we might face, and what services are out there. So, again, I gave you a little background on myself and why I do what I do. So let me walk you through some of the places I've been. Social workers are required to complete an internship process. The first one I did was in foster care. And I quickly decided, based on the reasons I just explained to you, that I was more interested in working at the opposite end of the spectrum. So my second year internship, I ended up out at Best Shalom Life Care Campus here in the West End. You probably know of it. Beautiful campus there. I was lucky enough to have Deirdre Arnowitz as my field instructor. She's the longest serving field instructor at the VCU School of Social Work. She's still the director of social services there. And I still consider her a friend and a mentor. So I worked under her a few days a week as I was completing my master's degree, and she was nice enough to give me a job, and I graduated. A 16-hour-a-week grant-funded position at the independent living facility there that's called Best Shalom Woods. In that facility, you will find low-income older adults who pay about a third of their income to live there. Now, if you're familiar with the Best Shalom Life Care Campus, it has the Woods, the independent living facility. It has a nursing home, a health and rehab center, and it has 2 assisted living facilities. So they're a bit of an outlier. Many campuses that you have where you have a continuation of care from an independent living setting to an assisted living to a nursing home. That's often referred to as a continuing care retirement community. A few of those here in town: Covenant Woods, Westminster Canterbury, Lakewood Manor, where you typically buy in and you have a continuum of care through the spectrum of your life. healthcare center. In nursing homes, you typically find folks who are there short-term for rehab, skilled nursing care is often referred to. Medicare covers that at 100% for generally 30 days, 20 days, I'm sorry. And then Medicare covers the rest for another 80 days. And the hope is that if you hurt yourself, if you needed a total knee or a total hip or what have you, you get your rehab and you go home. Now in nursing homes, we know that there are a certain number of people who live there. It is their home. And that's typically funded through private funds, long-term care insurance, or Medicaid. As I worked on that campus, I got a chance to work with older adults in their own apartments at Bechelem Woods, 16 hours a week. I also worked in the skilled nursing home as an admissions coordinator. I job shared there for all of 2 years, and that seems like an eternity when you're 22 or 23, right? So I worked on that campus for 2 years, and I got a good window into what a long-term care community was like, the ins and outs of skilled nursing care, what independent living looks like, and then of course assisted living as well. And as my story goes, I followed a girl out to Arizona, and she was going to school out there, and I needed a job. I had a master's degree, and I'd only been working for a couple of years, so I needed to work. And I was lucky enough to land a job at the Foundation for Senior Living in Phoenix, Arizona. And they brought me on board part-time as a community worker, if you will. I worked at a phone line, essentially, where we provided information referral to people in the community. And if they needed assistance, we'd go out and see them in their homes and work with them on a short-term basis to connect them with resources and what they might need. We have a similar program here in Virginia called Senior Connections. Every locality has an area agency on aging. You can call that agency, and it's a clearinghouse for information. But they can also provide somebody to come out and visit with you, to talk to you, to see what your house is like, your home situation is like. So I worked at the Foundation for Senior Living in that capacity for about a year, and then they were struggling to find a manager for their adult day center. At the time, the Foundation for Senior Living ran 7 adult day centers, and I think now they're down to 4. But they needed a social worker and a manager for this day center. So I signed up for that, and that was a joyful place. I make the joke now, as I work at Circle Center, which if you haven't been there is somewhat, well, it's an impressive place, I must say. And that's what drew me there. But when I first worked in adult day healthcare, this center was located in the back of a strip mall. Now, I was in Scottsdale, Arizona, and again, a one-room schoolhouse, if you will, this day center. You had to go around the back to the loading dock to get into my facility. We were licensed for 40. But even with those challenges, what a joyful thing it was to bring people together. You go back to the theme of connections. We know social isolation is a problem. It affects us in many ways. One of the anecdotes is adult day healthcare, to gather in a place, be together as people. And I witnessed that joy and was part of that at the Scottsdale Healthcare Adult Day Center. It was, again, a program of the Foundation for Senior Living. And I was there at that center for 3 years, and it really was a joyful time in my life, exploring Central Arizona and being a social worker at this day center and putting my thumbprint on it. And then one thing led to the next, and I migrated back to Virginia without the girl. Needed to find a job again. So I thought I'd broaden my, at this point I've been doing this for a few years and I have some experience with older adults, and I'm thinking this might be a niche, this might be a career. So I got involved with home health and hospice. Now, the company that I worked for at the time, Medi Home Health and Hospice, they did 2 specific services, home health nursing and hospice care. And they hired me as a hospice social worker, so for most of my job was visiting with patients who had a terminal condition, and the other piece of it was triaging home health patients. So again, a separate benefit there. That world of home health agencies, home care agencies, can be very overwhelming, I think, for the consumer to navigate. The names are similar. When I say home health, you may think of an aide coming in to help you. Typically, that benefit, home health nursing, is a Medicare-funded or an insurance-funded benefit. It's a short-term nursing benefit, if you will, where a nurse or an LPN comes into your house to help you to manage a condition. Maybe you've recently diagnosed with diabetes. Maybe you recently had knee surgery. So a nurse would come in and open your case, and then you have access to other disciplines such as occupational therapy, physical therapy, speech therapy, and social workers. We're part of that team too. They typically called us into the situation when there was a problem that we had to help work through. So again, a situation where I was able to go into the community and to see people in their own environments and to help them to stay independent. So again, when we talk about home services, home health nursing, personal care services, meaning an aide or a nurse, nursing assistant, I should say, that would come into your home to help you with the activities of daily living, eating, bathing, dressing, toileting, walking, some of the instrumental activities of daily living, such as meal preparation, communication, technology management. That's what these people can help you with. And again, any one of these topics, whether it be home health or hospice or personal care, we can dive into in any number of forums like this. But I hope to give you a breadth of what services I personally have worked in, but again, a good window onto what care is out there as we age. So working in home health and hospice is very rewarding, very hard as you might imagine. I often hesitate to say I worked in hospice when I go to a party. Drop the H on people, right? Oh, you work in hospice. Oh, how do you do that? Oh, well, older adults, 80, 90, who've lived a full life, not as tragic as the 40 or 30-year-old with 2 kids, but equally as challenging for that individual family. But that was often the way I explained it to people. Again, it teaches so much about life, living in the moment, the preciousness of life, working with older adults in general, but specifically in hospice care. Thoroughly enjoyed that. Had no intent of leaving that realm. It's a bit of a road warrior position in home health and hospice. You're moving, you're in an office a very limited amount of time, you're out in the community visiting with people. So flexibility in your time, you're seeing people in their homes, which is really exciting. But then I went to an open house at Circle Center and I saw the place, made note of it as a good social worker would do in terms of resources for families. And at the time, my wife was pregnant, we were moving into a new house, and I got wind that the social work position was going to be open at Circle Center. That Ann Spinks, my predecessor, who'd been there for 28 years when she retired, was retired, and I said to myself, wow, what a good opportunity, but I can't do that. My wife's pregnant, we're going to have a baby soon, we're going to do a new house. Well, a few days back on the job after Audrey was born, I got an email that said, come be our next social worker from Circle Center. And I thought, this is a sign. So I went home and penned that cover letter, and I was interviewing with Ann and Lori Philippo, our CEO, a few days later. I was lucky enough to land this job in a town that's full of social workers. VCU graduates a number of social workers every year. And I've been there for the last 6 years. Circle Center, in my mind, is a model for what adult day healthcare can be. It's an option that's outside of in-home care, that is outside of residential care. It's something that people don't think about. So that's one of your takeaways today. Each one of you knows somebody who is working with someone aging in need of assistance, or maybe you yourself need a place to be during the day. You owe it to yourself to explore all of your options that are out there. So the Circle Center has been at this for 43 years as a nonprofit. We started off on Stewart Circle in the Fan. We were the Stewart Circle Center for 10 years, until we moved off of that campus and moved to the United Methodist Service campus at Hamilton and Broad, where we were for 20 years before moving to our current location, which we moved to in 2009. We have about 20,000 square feet of space. We didn't build the structures, but we completely renovated them and put our stamp on them. We're licensed for 130, and we currently serve about 120 families, and we see on average 80 participants per day, and that's what we call our folks just who come to Circle Center, participants, as it notes an active and engaged person. You are participating actively in something. What is Circle Center? When I explain it to a potential participant, it's a place for you to be part of something bigger. Each one of you, as I look around this room, I'm assuming you're connected to some other organization, a church, a Rotary Club, whatever social circles it may be. Sometimes in retirement, latter retirement, disease processes, those circles begin to dissipate, and you don't have as much social connection. So come be a part of Circle Center where you're part of something bigger. Each person comes to Circle Center for different reasons. They each have an individualized plan of care. And they are each unique individuals that we attempt to engage with and provide a good, meaningful, purposeful day. When someone leaves the Circle Center at the end of the day, I want them to feel positive about where they are, what they've done, well-fed and tired and ready to go to bed. It's a joyful place to be. The staff of an adult day healthcare center, because I want to educate you not just about Circle Center, but adult day healthcare as a whole. It's like a senior center. Some people cringe when I say senior. Older adults is usually the phrase I use. I don't tend to use elderly. We have a great programming staff that's comprised of recreation therapists, a music therapist, several other activity coordinators. They are the creative minds that craft the schedule of events here at Circle Center each day and week. There's a certain rhythms in the day with meals and snacks and scheduled exercise programs. But each day is infused with a variety of activities that we help guide our participants to. Some are self-directed, some need lots of assistance to get to those activities. Nursing staff, we have 2 RNs on staff currently, numerous nursing assistants. We can triage whatever happens there during the day and help the participant and their family caregivers to manage complex care needs. Who comes to Circle Center? Typically people who fall into one of the 3 categories or a blending of all 3 of those categories. Physical assistance, mobility issues. I can't be alone because I need help getting to the restroom or getting to my meal. Cognitive issues, Alzheimer's disease and the related dementias. Or just the need for socialization. Again, as we age, sometimes we become more isolated. So the center gives people a place to congregate. But the perfect candidate really has a blending of all 3 of those issues. So great nursing staff, wonderful program staff. You get 2 social workers in the deal. Myself and Caitlin Cady, who is a licensed clinical social worker. We have an occupational therapist on staff. She's been there 43 years, if you can believe it. Her name is Sheila Selznick, and she is our captain and our institutional memory. Not too many places have someone like that who works there. Our CEO, Lori Phillippo, has been there 36 years and change. And again, my predecessor, Ann Spink, was there 28 years. So those 3 women were really the founding mothers, I say, of Circle Center, and the ones who shaped what it is that we do. So that takes me to where I am today. So that's my journey as a social worker and some of the places that I've been. And as we sit here today, think about yourself taking advantage of some of those services. Again, a shift in thinking. We're going to need the help as we age. What does that help look like? How do I feel about that help? Ask yourself those questions today. And my theory, and it's only a theory, sometimes as we age with dementia, we're not aware, obviously, that we have this disease. We're fine. I don't have a memory impairment. But that if we are more open to the idea that this will fail, regardless of what I do, and that I will need help, most of us don't go from working and running and all of this one day to not the next day, then the next. There's a transition period where we need help. And we got to think about what that looks like. So I encourage frank and open discussions amongst family. It helps if you start thinking earlier. The more legwork, and again, this is true to any problem in life, the more legwork, the more homework you do ahead of time, the more people you talk to, the better off you are when you need the assistance. Questions?
How is it funded, number one? And number two, did you bring any information that you take away with us?
I do. Back on the piano, I have a few things. So I'll tell you about those in a second. But let's talk about funding as a nonprofit. I mentioned Circle Center's been a nonprofit for 43 years. The problem with adult day healthcare specifically is that it's challenging under the current regulations and guidelines to fund it in a sustainable way. You just can't balance the budget with the type of care you need with what you're reimbursed through Medicaid or private pay dollars. So our income chart, our revenue chart is very colorful, okay? It costs us about $90 a day to do what we do. We charge folks $80 a day, and we require that they attend on 3 days per week. So automatically you see we're running a deficit there. We're also one of the larger Medicaid providers of adult day health care in the Richmond area. Medicaid has a long-term care component, and we see about 50 or so Medicaid clients every day. That reimbursement level is a little lower. It's in the $50 to $60 range. So again, a bigger deficit there per participant served. So we've always had to solicit funds from generous individuals, and when we walk through Circle Center, one of the things I always say on tours is that this experience, this place, what we do here is not sustainable without the generosity of other people. Many organizations, local governments were involved in funding the Circle Center as it is today. The United Way, various foundations, and private donors make it possible. How do people pay for it? Might be your question as well. Again, private pay, Medicaid pays for adult day health care, and long-term care insurance. Now, Circle Center does get scholarship dollars from Senior Connections. We usually can fund at least 2 people through the course of a year. We get some respite grant money from Senior Connections as well. But those are the 3 major ways that people pay for coming to Circle Center. We keep the cost of service low because it's important. That's one of the things that adult day represents as an option for long-term care. When you think about residential care, the costs are huge. $5,000 to $10,000 a month, not unheard of for residential care, whether you're talking assisted living or nursing home. In-home care, $20 to $25 an hour for a nursing assistant from an agency. When people come to Circle Center and someone's there from 7:30 to 5:30, I like to say the working adults are dropping mom off at 7:30 in the morning, getting to their job, and then picking up in the afternoon. That care is $8 an hour. You can't beat that. And that is a real value to people as we look at options. And then I did bring some literature, some things for you to read. I'll highlight those for you if you like. We put on a number of events for Active Aging Week, which are events at Circle Center, which highlight what we do. That is wrapping up Monday, at Circle Center with a drum circle. So I encourage you to come down and see it. You're welcome to pop in tomorrow for the drum circle and see. Well, our music therapist leads a drum circle, and we have numerous percussion instruments. And if you've ever been to a drum circle, it is just that. We circle up and somebody starts the rhythm and it goes on for maybe an hour. And it is a lot of movement and a lot of energy. I think by far it's going to be our best event. I think that's why we ended with the drum circle. So that's tomorrow. On the 8th, we have a program on the Veterans Aid and Attendance Pension. If you're a veteran and you serve during combat, at least one day during combat, you can come meet with Beth and Eric Jorgensen, who are local financial planner, about applying for the Veterans Aid and Attendance Pension. So that's happening on the 8th. And we're bringing a speaker to town, a lady named Tipa Snow, who is a occupational therapist and a professional trainer. She works with both professional caregivers and family caregivers to educate us on how to work with people with memory loss. So that's happening on December 11th, and there's a flyer about that. A few of my brochures and cards are there as well. We have a great website, circlecenterva.org, that will tell you everything, and a great little video there. Our Facebook page is pretty active with images of what we do at Circle Center each day. So check that out as well. And please call me. One of the reasons we have 2 social workers at Circle Center is we feel very strongly that what we do as answering calls from the community, if you're exploring adult day, lovely, I would love you to come and investigate Circle Center and see what that's all about. But we also feel like we want to connect you with what's out there. So don't hesitate to call me. I'm happy to discuss various aspects of what your needs are and point you in the right direction. No,
In your experience, what have been some of the signs that people who are caring for loved ones with dementia or Alzheimer's need to be aware of to know that they're ready for something like Circle Center?
well, we like to think about there's a window of opportunity for things like adult day health care. Get involved with the program early. If your question is, what are the signs and symptoms and when, I'm sorry, I'm not knowledgeable enough to rattle off the top 10 signs and symptoms of when you should seek medical care for Alzheimer's, but obviously as we age, sometimes there is something called age-related memory loss that happens. That is a normal part of aging. And then there are progressive diseases like Alzheimer's disease. And when to take advantage of services is somewhat the question, right? It's a tough call. I encourage people to explore it early. There's some line of thinking that maybe getting someone involved with a program like ours earlier so that you benefit over time and so that earlier in a disease process of memory disruption that Alzheimer's causes, that you become comfortable with the center and this becomes your place and just part of your daily routine versus trying to get that person involved later in a more impaired state. Now, the other side of that is that I'm so high functioning, I can't see myself in this room full of old people. Really, that congregate setting. I don't see myself like this. I'm not as bad off as these other people, even though I've been diagnosed with dementia. So we try, and if it doesn't take, my message to you is try again in 6 months. Come back and see me. We'll give it another try. By and large, we succeed. Usually getting someone adjusted to what we do at Circle Center in an adult day healthcare setting is simply a function of time. If you get your dad in the door enough times and we engage him in enough positive ways, eventually it sticks and he goes from being, I don't want to go to that place, to waking up in the morning and going, am I going to my job today? And that happens.
Do those people that go to the center, are living at home?
Predominantly, yes.
Okay. And there's no transportation from the center that picks them up? They have their own, have to get their own?
So, transportation. We don't have our own fleet. Families bring their loved ones. The GRTC caravan system in Richmond and Henrico and their new on-demand service is very helpful in getting people around. That's the most affordable option. Medical transportation companies, other ways to get to Circle Center.
If one were interested in seeing Circle Center and thought the drumming session sounded like something they'd like to see, can they come just watch?
That's what I'm encouraging you to do. So there's a bunch of flyers up there about Active Aging Week, and down at the bottom is the last one for October 7th. That's tomorrow, right?
Yeah.
Right.
At what time is the drumming?
Let me check. I think it's 11. Yeah, 11. 1:30. I'm sorry. 1:30 is the drum set. That's 1:30.
What next?
1:30.
1:30. Thank you.
Did I answer your question?
Yeah, oh, yeah.
Okay. There's another question over here.
How does Circle Center determine when somebody that's there is no longer eligible to stay there?
Right.
And
When can we not do what we do is the question. What are the deal breakers? Yeah, I've had a rash of those lately, unfortunately. Typically, I boil it down to 2 factors. The folks who come to Circle Center, we need for them to be able to bear their own weight. They have to be able to assist in their own transfer. So you'll see a lot of people in wheelchairs at Circle Center, but they ultimately can get up and stand and bear some of their weight and pivot. Okay. The other issue really boils down to behavioral issues. Can the person exist in the group setting. It's an individualized experience within the group setting. So if you're yelling and screaming and ranting and raving and hitting and all this, you're going to be in my office and we're going to be having a conversation. And I say that, again, if we're dealing with that with somebody with a neurocognitive disorder, I just can't tell you to stop doing that, right? We've got to look at all the reasons why these things may be happening, and we do. Circle Center prides itself on being able to work with people with neurocognitive disorders and work through issues. But there come times when there are limitations to what we can do. Somebody who's beating on the door and where's my wife and I'm going home, that is an aggressive exit seeker. That becomes problematic. But we really look at each individual on a case-by-case basis.
What are the resources for caregivers?
Caregivers. So when you first call me, I'm thinking of your loved one, I'm thinking of you, and I'm thinking of all the people that are in that person's orbit, and how do we support the whole network, the whole system. We have caregiver support groups that meet at Circle Center. Last Thursday of the month, we have a support group. It's a general caregivers group. First Tuesday of the month, we have a Parkinson's disease group. We also run a specific group for spouses, first and third Mondays. Caregiver support flyers are back there on the back table. But I like to say that a large portion of my job is caregiver coaching. It's talking to you about how you care for your loved one, how you are care partnering with them. And so much of that is not necessarily a tangible skill. It's up here, it's in our approach, in our thinking, and working with this person. So Caitlin, wherever your support lies within the staff, I often bill the 35 or so full-time people at Circle Center as your support team caring for your loved one. So whether you're talking with a social worker or the OT or the rec therapist, you can glean information from the various disciplines that are in an adult day healthcare center. And we encourage you to do that.
Thank you.
One more.
How does somebody find somebody who would be a case manager
Right.
in case there's no family around?
Right, that is a good question. They used to be called geriatric care managers, and and they've changed names, and I'm sorry I can't recall at the top of my head what that is. But there are people that you can enlist if you are a son or a daughter or a family member at distance and you need boots on the ground help to orchestrate care. There are professionals that can do that for you. Yeah. There's lots of helping people out there. I've highlighted some of the sort of the pillars of care that are out there. There are lots of ancillary services that are interesting, that are coming online, that make it so you don't have to do all the legwork. Senior-focused moving companies.
I'm just thinking of a monitor.
A monitor, somebody to check in.
Manager.
Sometimes that can be your home care agency. If you had a good home care agency that was staffing a caregiver in your loved one's home, and they had a social worker or a nurse manager who was going out to visit and check in and orchestrate that care and report back to you. So I think a good home care agency could do that, but you could also enlist a third party to be another set of eyes on the individual. Again, if we're talking about a distance caregiving situation where you've got mom in Richmond and sons in California, busy working and needs help assisting. So there are different arrangements that you can put into place that would help you do that. I'm a big believer that there's a solution out there for every situation, and there are a lot of good professionals right here in the Richmond area that can help manage just that. Any other questions?
Just, as I'm completely uninformed on your line of work,
Okay.
it's interesting to try to ramp up. But a couple of questions that I see coming up in my head is when the subject of your life is in need of your services, but in denial that he or she needs your services. And number two, the caregiver in the particular situation is about 2/4 low on patience.
Oh, yeah.
How do you deal with either or both of those?
Boy, you said a mouthful there. That is my world on a day-to-day basis. I don't need this type of care. I'm not ready for this. How many people have come and sat in our little family room and I've introduced the Circle Center and say, I don't need this. And that's what I was getting back to, you know. Everybody in this room, if you could just tell yourself to be a little more open to this experience, that you may need help and that there's joy and value in doing that. Both for yourself and for your poor wife who's going to help take care of you, right? I'm assuming this is your wife right here, right? All right. And you mentioned caregivers with the tank half empty. I mean, it's a proven fact that for your wife caring for you, she's going to shave years off her life doing so. And the more we can support her ahead of time, proactively, the better off she's going to be. So, caregivers, we spend a lot of time, caregivers and I, talking about all kinds of things. But really just being down in the weeds together and trying to support them as best we can. And really preaching that as a caregiver, you've got to aggressively seek your own self-care. I think we should do that in life in general. But specifically as a caregiver, you get so bogged down in it. And it is so overwhelming. I think caregiving for someone with a neurocognitive disorder is one of the hardest things that a human being can do. And because of that, we need to take every step imaginable. If you're a caregiver and you don't go to a caregiver support group, that's an important pillar, I think, of your own self-care. Get yourself with other people and talk about it and process it and vent about it and cry about it. A support group can be instrumental in helping caregivers see a counselor, utilize services. Again, the caregiver issue is huge, and if we can't keep her well and you need help, then the ship starts to sink. So we focus a lot of our energies on supporting caregivers.
Jay, thank you so much. As you know, this is just the beginning of a conversation that needs to keep happening. Thank you for being here and opening our minds to resources and helping connect us to those resources. If you can stay a little bit later after this, we've got church at 11 for those who haven't been to church yet, but I know there will be people who would love to engage you a little bit longer.
Thank you so much.
Thank you so much.